Let's discuss damp heat in the liver and gallbladder. This is due to damp heat accumulating in the liver and gallbladder, impeding the smooth flow of qi. It is seen in the middle jaw level of the Sanjiao patterns. This pattern can lead to liver and gallbladder damp heat accumulating and congealing. Key symptoms: distending pain in the right hypochondrium, anorexia, abdominal distension, jaundice, which is a yellowish color of the skin and sclera of the eyes, vaginal itching, and signs of a damp heat pattern. This pattern is due to invasion of pathogenic damp heat or excessive consumption of warm, fatty, or greasy or sweet foods which produce dampness and heat, or spleen deficiency causing the formation of dampness, which then turns into heat, followed by earth, insulting wood, all of which lead to damp heat accumulating in the liver and gallbladder. Here we have the analysis of damp heat in the liver and gallbladder. If the smooth flow of qi is impeded, qi does not flow freely, resulting in distending and burning pain in the right hypochondrium. Impeding the smooth flow of qi can also bring about gallbladder qi rising, leading to bitter taste in the mouth. Impeding the smooth flow of qi will result in the outward overflow of bile, and this will lead to jaundice, which is an orange peel color. Damp heat pathogen in the Shaoyang channel will result to alternating chills and fever. When liver qi invades the spleen and stomach, abdominal distension, irregular defecations, this will lead to anorexia, nausea, and vomiting. Damp heat infusing downwards along the channel will lead to yellow and foul leukorrhea, vaginal itching, and in males, scrotal eczema, redness and swelling of the testes, and scanty dark urine. Tongue will be red with a yellow greasy coating, wiry and rapid or slippery and rapid pulse. All of this are signs of a damp heat pattern. Treatment principle: drain damp heat from the liver and gallbladder. We choose from liver 2, 14, bladder 18, 19, gallbladder 24, 34, 41, Sanjiao 5, Danang Shui, Li 11, spleen 6, and Do 9. Diddle technique is draining. Liver 2, 14, GB 24, 34, bladder 18, 19, and Do 9 drain damp heat from the liver and gallbladder. GB 41 and Sanjiao 5 together open daimai and drain damp heat. Spleen 6 and 9 will drain dampness. Li 11 drains damp heat. Danan Shui is an empirical point for the treatment of gallbladder disorders. When there is damp heat in the liver and gallbladder, the patient should avoid consuming substances that create heat or dampness, especially if these substances have an affinity with the liver. Alcohol, hot spices, fried food, and too much red meat should particularly be avoided, as well as foods such as dairy products, sugar, sweets, nuts, bananas, and avocados. A liver that is burdened by pharmaceutical medicine, alcohol, chemicals, heavy metals, and other pollutants will have difficulty carrying out its metabolic functions. So caution should be exercised, and the consumption of all kinds of medicine, including dietary supplements and herbal remedies, should be limited as much as possible. Stress and pent-up emotion, especially anger and frustration, can create heat in the liver. A person with damp heat in the liver and gallbladder should try and address these emotional issues. Exercise, sport, and physical training will be beneficial, as physical activity will help to circulate and spread stagnant liver qi, which is often involved in the creation of heat in the liver. Thank you so much for listening.